Welcome to Monday's edition of COVID-19. For the first time in about 2.5 months, Korea's daily cases are hovering on the 200 level. And against this backdrop, authorities today will hold an extended briefing to include the latest details of our vaccination campaign. We start the program now with the broader pandemic coverage with our Kwon So-ah. So let's begin here in Korea for this Monday.
Sure, Sunny. Well, as I said, the numbers are dipping, and that's a good sign a few days before the Lunar New Year holidays. And as Sunny just said, for the first time in 2.5 months, the number dropped to the high 200s, with 264 of those infections this Monday being domestic infections and 25 of those imported cases. And that brings the total here in the nation to 81,185, and the death toll stands at 1,474. With 3 additional fatalities. Now, if we take a look at our graph now, we see an on-week drop from the low 300s now to the high 200s. And for the past week, most of the time, the numbers were hovering in the 300s or 400s. Now, while 13 provinces or major cities have been confirming new cases this Monday, it's still the metropolitan region where most cases are concentrated in, with Seoul here a triple-digit figure, and new cases are linked to, for instance, restaurants and sports facilities, so still day-to-day activities. But it is good to see that we are seeing a downward trend, and also some regions that are not reporting a single case on some days. So given this trend, the government over the weekend announced an extension to operating hours to 10 p.m. at businesses such as restaurants, coffee shops, and indoor sports facilities outside the metropolitan region beginning this Monday.
Right, so, and I understand officials are also reviewing further changes to social distancing guidelines.
Right, Sunny. The authorities will decide what to do with social distancing measures past the Lunar New Year holiday, so after February 14th. So this could also mean an easing on the restrictions in the metropolitan region, given the overall recent downward trend.
We will comprehensively review possible changes in social distancing levels and improvements to our antivirus guidelines, and come up with a reasonable solution that seeks to balance prevention and the economy.
Now, turning to the international updates, over in China's Hubei province, an independent panel of scientists led by the World Health Organization, who are wrapping up investigations on the origins of the coronavirus, say they have found important clues regarding a seafood market in Wuhan, the city where COVID-19 was first detected. So let's hope that these findings will give us some answers on why we are dealing with such a high amount of infections around the world. 106.6 million is the figure we're seeing now, and the death toll at around 2.3 million. If we take a closer look at the major outbreaks, we are seeing some improvement in the U.S., for instance, as the daily figure of infections was below 100,000 as of this noon Korea time, and also some improvements in the UK and Germany. Germany now having some 6,000 new cases. Meanwhile, although not on this table, we have the Netherlands now surpassing the 1 million mark in total cases over the weekend. So with that, 21 countries around the world have hit that 1 million milestone. And those are the updates I have for now, but I'll be back in a bit after the government briefing. Sunny?
All right, so thank you for now. On the international front, Brazil has been battling a brutal second wave since last November, with more than 1,000 deaths per day in recent days. For more, I have Tierney Oliveira live on the line. Welcome back to Tierney.
Good evening, and thank you very much for having me, Sunny.
Right now, I hear hospitals there have been pushed to breaking point, with both medical staff and supplies, including respirators, in very short supply. Please tell us more about the situation in Brazil, Tierney.
The situation here in Brazil is still quite serious, Sunny. We have 9.5 million confirmed COVID-19 cases. Brazil has registered more than 50,600 cases only in the past 24 hours. Now, the official number of deaths caused by the virus is more than 231,000 Brazilian citizens. The situation about the ventilators are a little better, but it's still a huge problem.
Testioni, doctors in Brazil have also been the first to identify a dual infection with two separate strains of the coronavirus. What more can you tell us about this alarming finding?
Sure, Sunny. The variant of the COVID-19 was found in Manaus, north of Brazil, in the state of Amazon. The so-called P1 mutation was detected between December and January this year. Nevertheless, scientists say it seems to be too early to affirm that this variant is more contagious or lethal. Genetic expert Renato Aguiar, a professor at the Federal University of Minas Gerais, explains that the severity and the mortality rate from the COVID-19 has no direct connection with mutations. He said the behavior of the P1 strain will depend on how humans behave. Aguiar said, and I quote, "More gatherings will stimulate the virus to spread faster. It's a cascade. The more gatherings, the more the virus replicates. The more it replicates, the more it mutates, and more abundant it becomes," unquote.
Testioni, how are authorities in Brazil responding to the presence of these variants then?
Since the beginning of the pandemic, Sunny, politicians and authorities seem to differ on how to proceed and on how serious safety rules and quarantine norms should be taken. For instance, the president, Jair Bolsonaro, himself and his staff has been seen several times and occasions not using a mask or taking proper social distancing. However, the government has been pressured by the population and has consequently started the vaccination program.
And speaking about the vaccination campaign, it began on the 17th of last month in Brazil. How many people have been inoculated so far, and what has been the public response to the campaign?
Less than 1% of the population has been vaccinated until now. The vaccination against the coronavirus in Brazil started on January the 17th in São Paulo, and all the Brazilian capitals received doses of the CoronaVac and Oxford vaccines from the Ministry of Health. The plan initially includes elderly people living in nursing homes, disabled people, health workers, and indigenous people living in indigenous lands.
Testioni, securing a stable supply of vaccines is proving to be quite a challenge for many countries. What plans are in the works there to ensure a proper supply of vaccines?
Well, the Brazilian government hasn't yet got enough vaccines for all the population. But last Saturday, February the 6th, the Ministry of Health started distributing 2.9 million doses of the CoronaVac vaccine made by the Butantan Institute in a partnership with the Chinese pharmaceutical laboratory Sinovac. And it's still last Saturday, the Butantan Institute started to produce 8.6 million doses of the CoronaVac that are supposed to be released to the Brazilian citizens for vaccination on February the 23rd.
I see. All right, Testioni, as always, thank you very much for making the time to join us live at this hour.
Thank you, Sunny.
Right, it's time now for the regular briefing on COVID-19 here in Korea for this Monday. Now, as mentioned earlier, authorities today are poised to disclose the latest information regarding the country's inoculation campaign as well. Meanwhile, social restrictions on gatherings remain intact until the 14th of this month. Social gatherings of 5 or more people, indoors and outdoors that is, are banned across the nation. Violations can result in fines of up to 100,000 won. Now, I understand the briefing is about to start. We'll come back to you afterwards with a summary.
Let us now begin our regular briefing for February 8th, Monday. First of all, we have Commissioner Chung Eun-kyung. Let us now begin our regular briefing on the COVID-19 situation here in South Korea. As of February 8th midnight, we have 264 new local infections and 25 new imported cases. The total caseload now stands at 81,185. And currently we have 8,493 people remaining in quarantine, while 188 patients have critical or severe conditions. And we had 3 additional fatalities, with the accumulated death toll now standing at 1,474, and the fatality rate stands at 1.82%. I extend my deepest condolences to the deceased and the members of the bereaved families. And as for the details of the domestic infections, please refer to the press kit. And looking at the past week, let us give you some more information on the quarantine measures. During the past week, we have seen 354 average daily domestic infections, which is about 16.4% decline from the previous week. And also, imported cases stands at 27.7, meaning that on average daily cases we have hovering around 30. And in the metropolitan area, we have still more than 200 cases in the metropolitan area. And most of the non-metropolitan regions are seeing a downtrend in the virus infections. And during the past week, looking at the sources of infection, the contact with the previous confirmed cases stands at about 36%, about 900 cases, and 25.4% from cluster infections, and about 8.3% stemming from hospitals and nursing homes. And also we had about 7.2% or 192 cases of imported cases, and about 23% of the cases are under investigation. And compared to the previous week, we are seeing a slight increase in the proportion of patients who have been confirmed as the contact with the domestic of the previous confirmed cases, and we have seen a decline in the cluster infections. And we have reported 15 new cluster infections. 5 of them were workplaces, and they range from interior companies, manufacturing companies, wholesale livestock products companies, as well as automobile companies. And we also have 2 cases of places of worship, family gatherings, as well as other nursing homes. And we are seeing a decline of the critically ill patients. However, we still have the fatality rate standing at 1.82%. And for the fatality rate above the age of 80, it hovers around 20%. So it's quite high relatively, and about 43% of the critically ill patients right now are over the age of 80, and we had about 50 cases of fatalities last week, and also most of these cases are in the higher age group. And as for the sources of infection for these fatalities, most of the people, about 50% of them, were stemming from cluster infections, stemming from hospitals and nursing homes. And we also identified out of the 49 had underlying illnesses. And here are some updates on our new variants being reported here in South Korea. And after the 3rd of February, we have carried out 77 analyses. And as for the 65 domestically transmitted cases, no new variants have been reported. And we have identified 3 new variants from the imported cases. And all of them have been identified at the ports or points of entry, and all of them were stemming from the new variant stemming from the UK, and all of them were South Korean nationals. And we also do not see local cluster infections for these new variants. However, we have been identified 2 more people have tested positive as for the people who were sitting in the vicinity area on the same aircraft as these confirmed cases. And we have a total of 54 new variants, 40 of them stemming from the UK and 5 from Brazil. And also, as for the influenza outbreak, we are still seeing it below the average, yearly average. And next, we have analyzed some of the risk risk factors of COVID-19, here are some details. During the Lunar New Year holiday, and I believe that due to the eased social distancing measures in some parts, we believe that there could be many people coming into contact. And especially during the Lunar New Year holidays, we still have many risks of family gatherings. And also in the non-metropolitan area, business hour restrictions have been eased for multi-use facilities from 9 p.m. to 10 p.m. And we also see a day-to-day cluster infections stemming from places of worship, hospitals, and so forth. And to this end, the government continues to impose a ban on gatherings of 5 or more people, and we will be carrying out special quarantine measures for the Lunar New Year holiday. And we will also intensify our quarantine measures for places of worship, hospitals, and workplaces as well. And especially for the workplaces like the livestock processing companies and so forth, we will be intensifying our quarantine. We will also carry out our operation of the testing screening centers, and we ask you to take particular precautions during the Lunar New Year holiday, and please refrain from having gatherings of 5 or more people, and also wear face masks at all times when you are visiting multi-use facilities. And please ventilate your space on a regular basis. And second, we still have high risks of the domestic infections of the new variants. We have more countries reporting these new variants, and here in South Korea as well, we have seen increase to 54 new variants here in the country. So we have high risks of these virus spreading as well. And to this end, in order to stem the influx of the new variants, the government will be also carrying out the mandatory PCR negative document to all of the people coming in from Africa, including not only the foreigners, but also the Korean nationals as well. And as for all of the people traveling from Africa, all of them will also be placed at the temporary shelter sites, and they will also carry out the PCR testings before they are discharged. And we will be carrying out the genetic sequencing testings, and also we will be intensifying our monitoring of these inbound travelers. And for the next 5 to 10 days, we will be intensifying our quarantine measures for those people on self-quarantine. And also, we would also like to stem the further spread of the virus through these families who live together. So we ask for you to comply with these quarantine measures strictly. And next, as for the Lunar New Year holidays, we have some recommendations for the people to abide by the quarantine measures. As highlighted, we ask you to refrain from traveling and visiting your hometowns or relatives, and please refrain from any gatherings of 5 or more people. Please refrain from having social gatherings as well. If you have to visit your relatives, please wear your face mask, and also minimize your time of stay and wash your hands on a regular basis. And if you have any symptoms, do not visit your family members and get tested as soon as possible. The government will also have our call center hotline opened during the 24 hours. And also we will be intensifying our quarantine measures for all inbound travelers as well. And next, we also have some vaccination plans updates. And we are carrying out the pan-government efforts, and we have the cold chain system which is under monitoring, and we are also ensuring the safe storage and distribution of the vaccines here in South Korea. To this end, our agency is to ensure the safe distribution and the delivery, and together with the Ministry of Defense, we are also carrying out a mock drill as well. This has been carried out earlier this month, and in order to ensure the safe distribution and storage, we will also continue to cooperate with the Ministry of Food and Drug Safety to provide necessary protocols and guidelines, and they have been distributed already. And starting from tomorrow, we will also be carrying out our vaccination centers and also monitoring of these vaccination centers at the National Medical Center, and we will also be carrying out a mock drill as well. And during this drill, we will see any possible situations that could break out during the process of inoculations. And starting from the 8th of February, we will also target our vaccination online training for all of the health professionals as well as hospitals. And we will be providing a tailored training, and we will also provide intensified training education for the platform as well. And we also have a different targets as well, and we will also mandate all of the people who will be engaging in the inoculation to get these training in advance. And we will also have both online and offline training, a hands-on approach as well. So we will be carrying out these going forward.
네, 브리핑을 이것으로 마치겠습니다.
네, 보도 자료에 대한 설명은 이상 마치겠습니다. 오늘 역학과 방역과 관련된.
Right, there was Chong Young with Monday's afternoon briefing. So, what did she have to say?
First off, we are seeing a decline in cases, COVID-19 cases here in the country, as 354 was the average number of domestic infections in the past week. So that's down by around 16.4%. And there have been 15 new clusters in that span, which were related to businesses, companies, religious facilities, as well as family gatherings. So speaking of family gatherings, Tong stressed that over the Lunar New Year holiday, people should refrain from visiting their relatives and families, and to also try to decrease traveling as much as possible, as the Lunar New Year span is one of the risk factors she spoke of that could lead to further spreads of the virus. And another risk factor is the variants from abroad, as there have been additional cases confirmed in the past days. Now the country has 3 more cases from the UK variant, which raises the total to 54 infections. And also some updates on the vaccine program. Since the beginning of this month, there have been trainings regarding the transportation and also the storage of the vaccines, and those processes will go on. As Chong mentioned, that beginning today, for instance, online training for hospitals and civil workers will also proceed, so offline and online trainings regarding the vaccination program.
Right, that is good to know. All right, so thank you for that. I'll see you again tomorrow.
See you tomorrow.
The ripple effects of the pandemic are being felt on the dining table as well. COVID-19 has raised commodity prices, and we have details in this next report, that is. Do take a look.
The COVID-19 pandemic has driven up global food prices to their highest level in years. The FAO's Food Prices Index has risen for the 7th consecutive month as of December 2020. As a result, the number of people around the world living in extreme poverty could hit 940 million this year, the highest figure in more than 3 decades.
The food price is, and available income has led to worsening of inequality, as a poor family has dwindling incomes, and so they have no choice but to choose the cheaper food and less nutritious food. The whole world is requiring about $35 billion in aid funding, and WFP alone is needing about $50 billion in 2021. So 2021 will be going to be catastrophic based on what we are seeing at this stage of the game. And for a dozen countries, famine is knocking on the door.
Here at home, Korean consumers are also feeling the pinch amid the runaway food prices.
코로나19 영향과 더불어 작년 역대 최장 기간을 기록한 장마와 태풍에 이어 올해 초 북극 한파등 기상 요인, 그리고 조류 인플루엔자까지 한 해 일어나기 힘든 일들이 한데 모여 밥상 물가 상승을 이끌었습니다.
The prices of major agriculture and livestock products that are most often found on Korean dinner tables rose anywhere between 16 to 80% compared to last year.
손이 떨릴 정도로 좀 많이 올라서 살 때마다 계속 확인을 하게 돼요.
The pressure on household budgets is rising ahead of the Lunar New Year holidays in Korea. According to data, a family of 4 in the country could spend up to 18% more in groceries in the coming Lunar New Year compared to last year. The Korean government has vowed to roll out new measures to bring food prices under control.
코로나 위기 속에서도 민생, 지역 경제 안정, 명절 온기를 지켜내고자 맞춤형 피해 지원 대책에 이어 이번에 설 민생 안정 대책과 축산물 수급 안정 대책을 마련하였습니다.
The government has also promised to supply 40% more Lunar New Year staples, such as cabbages, radishes, and apples, into the market to curb the rising cost of food. But what can the government do to prepare ahead of time in case of a similar crisis in the future?
올해 보면 우리 마늘이나 양파 같은 경우는 재배 면적을 사전 신고를 의무화하는 그 제도를 통과시켰어요. 면적이 관리가 됐음에도 불구하고 좀 수급에 문제가 생기면 그때 정부가 좀 개입하고 단기적으로 뭘 하기보다는 좀 중장기적으로 가격 안정화 정책을 추진하는 게 바람직하다고 보고 있습니다.
It's hoped that these measures could provide some relief to the nation's people during their time of feast and festivities over the New Year holidays.
최근 영국발 변이 바이러스가 유입 단계에서 차단되지 못하고 국내로 전파된 사례가 확인되었습니다. 지역사회로의 광범위한 확산을 선제적으로 차단하는 것이 급선무일 것입니다.
긴장감의 해이나 또 3월 이후에 여러 가지 여건 자체가 코로나19의 또 다른 유행으로 될 가능성도 배제할 수 없기 때문에
Concerns are mounting as the presence of variants in the community complicate efforts to contain the third wave amid grim forecasts of a fourth wave in the coming months should we fail to effectively curb the latest contagion. For more on this, I have Dr. David Kwak from Soonchunhyang University Hospital. Welcome back, Dr. Kwak.
Good afternoon.
And I also have Dr. Kim Seung-taek from Institute Pasteur Korea. Good to see you again, Dr. Kim.
Good afternoon.
Now, Dr. Kwak, as we saw in the video, Prime Minister Chung Se-kyun spoke about a UK variant spreading into the community, infecting at least 4 people last week. What are the chances of a large-scale outbreak of these variants here in the country?
If we look back into the history that we've had so far with the pandemic, it always came through our country, and it was inevitable that when a new variant happened, it always happened in our country as well. I think it's really a matter of time that the new variants also take dominance in our country. But we have to also put our most effort into delaying that influx of process so that we could be better prepared in the fight against the new variants as well. Hopefully that'll mean that we'll get enough time to vaccinate ourselves. That'll be effective against these new variants as well. But also, if we keep reminding ourselves that social distancing is really the most powerful tool that we have at hand, we also need to remind ourselves that we also need to be socially distancing at this moment, not easing ourselves from the tiresome history yet.
Right. Dr. Kim, here in Korea, a patient who was infected with the variant tested positive for COVID-19 even 23 days after the first confirmation. What are the implications of this finding?
I think it's not really, just a unusual thing. The virus is sometimes does not last for such a long time, but actually it depends on the some host condition. In this case, the patient condition. If the patient is suffering from some immune compromising, the condition, then the virus can just stay for a long time. So, but based on the report, I do not have any such kind of information from this. So we need some information from the patient as well. And also, mostly when we just detect the virus, that is depending on some real-time RT-PCR method that actually measures the copy number of the RNA, not the real infectious viruses. So sometimes, depending on the cases, the RNA itself just lasts a very long time. But the information so far that I have obtained, that the specific virus does not have any enough scientific evidence that such a long time the maintenance in our body.
I see. Dr. Kwak, the GR strain of the coronavirus has been identified among some transport workers in the southern port city of Busan. Now, this is reportedly the second such case, following the first back in July aboard a Russian ship. What are the implications of this reality?
Well, it also means that we cannot completely avoid the influx from the foreign variants. As I said before, whether it be GR strain, whether it be the 11153 strain possibly coming from South Africa, if we don't do the most we can to completely block the national borders, it is sooner or later going to get into our country and start spreading. With the GR strain, luckily we were able to stop the spread of the virus back 6 months ago, and it no longer affected our country. Now is not quite the case, and it also tells us that even back in July, the GR strains were mostly found in Busan area, in the shipyards where the foreign shipping people were actually found to have that such strain. It only further emphasizes we need to do a little bit more of tightening our national borders in regards to how we're going to fight against the new variants coming in. But also I have to emphasize, once again, I'm pretty much telling the same thing, we've never really succeeded in completely blocking new variants from coming into the country. So we have to consider it will inevitably come into the country, but we just have to be better prepared how we are going to fight against these new variants when they do arrive on our soils.
Right. Now, Dr. Kim, Korea is one out of at least 9 countries that have confirmed the 3 strains, the 3 variants so far, the one from the UK, South Africa and Brazil. What are the individual traits of these 3 variants of the coronavirus?
Well, obviously, just the viral genome sequences are different. And then at this moment, we are particularly interested in the sequence variation in the spike region, because all the vaccine development is targeting to the spike protein. And then so far, based on all the clinical trials and other some in vitro cell culture experiments, I think a UK strain is somehow somehow is what we can actually somehow deal with the vaccines and probably some therapeutic antibody, I think. But for the South African thing it's a little bit just trickier. But based on some efficacy trial of efficacy clinical trial of some vaccines, we're still just observing more than 50% of efficacy. But we are still just concerned about this. And I think concerned about, and also for some therapeutic antibody, we need some rigorous the results from some experiments as well. So the coexistence of the variants, that might be something that can happen. I mean, well, in our body, I mean, if I just infected with some coronaviruses, the viruses actually mutated and then spontaneously make many just variants within our body. That is so-called quasi-species variation that happens to many, I mean, especially some RNA viruses like HIV and then HCV as well. So then actually such kind of a coexistence also some potentially just a reason to make some novel recombinant viruses. That I think many scientists believe that this SARS-CoV-2 also somehow generated by some kind of some recombination within the bat host, because the bat is traditionally known as a pretty, I mean, some immense some reservoir for many just emerging just viruses. And then SARS-like coronaviruses many such things were actually reported in the bats as well. So there is some chance, but I think in terms of our just vaccines and maybe therapeutics, I'm not really concerned that much at the moment, because somehow I think these are probably sometimes it is very similar. We can actually just defend ourselves with our just current drug under development and the drugs that we have right now.
I see. Meanwhile, Dr. Kwak, do tell us a bit more about efforts needed to further strengthen perhaps our COVID-19 protocols at our airports and our seaports that you mentioned earlier.
Well, I'm hoping that we would be able to tighten the national borders a little further. As we've seen in the past, we were one of the countries that were more open to accepting people actually flying in. Now we've implemented screenings like mandatory RT-PCR results for everybody who is coming into the country, also mandatory quarantines for 14 days once they're in the country. Maybe a step a little further could be taken by the government. Maybe only those who have proven twice of the RT-PCR could come into the country, or maybe those who are staying for 14 days could be extended to 21 or more, and then they could have to be RT-PCR negative when they're actually leaving the social self-quarantining measures and whatnot. So I guess that would be the first idea that I could possibly have from myself. Number two, as I said before, the most powerful tool that we have at our hand is really socially distancing. I know everybody's becoming tired, as myself. We are really becoming very tired of these longevity of the whole fight against this virus. But the reality is it's still there, and we still have to fight successfully to really survive through. I'm not going to say that we should keep the social distancing level at 2.5, but we can make adjustment enough that that enough population would be socially distancing still, that know what virus ever could be transmitting amongst each other.
Right. Dr. Kim, authorities meanwhile are calling for sequencing all positive COVID-19 tests to scan for variants. What are your thoughts?
Well, ideally, that's the best to actually detect all the variants possible. But the current the real-time RT-PCR actually detects all the presence of just the SARS coronavirus 2, and also sometimes depending on the machine, we can also detect how many the virus, not virus actually, just how many just RNAs are actually just existing within the body. But this method does not actually distinguish whether this virus is like a wild-type virus or like a variant. So in this case, the current method that we can say this is a variant is just the sequence the whole genome. And then actually although we are actually talking about only the spike mutation, but those UK and the South African and the Brazilian strain, they also report other variation other than the regions, other than the spike region. So in order to just confirm completely, we need some sequence, so-called whole genome sequencing. But that actually takes much more effort and then the money and the things like that. So we have to somehow just prioritize which the person should be actually just tested in terms of this whole genome sequencing. I think probably just the chances are probably the people are coming from just foreign countries. We have actually just focused on the people from outside, and then once they are actually positive for some SARS-CoV-2, then we can actually try some whole genome sequencing to see whether this person is infected by the variant or not.
Right, I see. Dr. Kwak, there are concerns about a fourth wave here in Korea amid the presence of variants. Now, how do you respond to these concerns? And in your view, what are the variables that could perhaps trigger a fourth wave in the country?
Well, it's so let me answer the last question first. Obviously, it's the occasions like we're about to have, like Seollal, the holidays that have to have people put together for a certain period of time. Those are the chances that creates the virus to actually transmit through not just the social gatherings of friends, but more so in close proximate family members. That being said, I believe if we compare the variants from the UK, Brazil, and from South Africa, I believe South Africa variant is much more transmissible than the other two. To my knowledge, it took about 2 to 3 months for Brazilian one and the UK one to spread to up to about 50 to 60% of the population. If my knowledge is correct, the South African one actually took only a few weeks for 90% or more of the population to be infected with the new variant. It's that much more transmissible, and it is also concurrently being found in countries like the United States and other countries. It is only a matter of time. It it actually reaches us. We just have to think ahead and how we're going to, when it arrives on ourselves, how we're going to be prepared against it. Obviously, the first method that comes into my mind is the vaccination. The right choice of vaccination we have to make that would completely block out these new variants. Number two, the medication we're currently developing as well as thinking of importing, we have to make sure that they also are quite effective against these new variants. And number three, and again, I emphasize again, keep socially distancing.
Right, of course. Dr. Kim, our vaccine rollout will begin later this month with doses from Pfizer and AstraZeneca. What are some factors we need to keep in mind to ensure a proper vaccination of the public?
Well, I think it's some prioritization of by the government is very important, and then I think that there seems to be some kind of some consensus even in Korea and also in some foreign countries. Just we should go for some healthcare workers first, and then the aged people, and then some people in the some sort of just confined, just living in some confined, just the building or some facilities, and then we'll actually take such kind of order, and then well, that's it. And then there's some sort of just precautions that actually some healthcare workers and the professionals actually suggest this. So we'll just keep in mind such procedure too. Yeah.
Right. Dr. Kwak, South Africa, as you mentioned, meanwhile, has put on hold the AstraZeneca's COVID-19 shot after findings that it had minimal protection against mild to moderate infection caused by its variant in the country. What are your thoughts on this?
Well, that's particularly what I am really concerned about at this point. Just coming into the show, I noticed that a couple of news reports are reporting that out of about 1,000 or more people that they've tested these vaccinations on, they've actually found less than 22% effectiveness of the vaccines against the new variant. It really, if it is true, it means it's completely failing against the new variant. We really have to find an alternative to that specific vaccination. Also, sadly, I think for our country, the first choice of vaccination, not in the time and sequence wise, but more so in the numeric sense, was AstraZeneca. We have to really dig into this for the government to find out what actually is true of clinical findings of the trials against all the new variants that are coming up, and really make adjustment to making the right choice for the vaccinations. Hopefully, we'll be able to equip ourselves with much better vaccination choice and inoculate ourselves with a vaccination type that will completely protect us from any of the new variants to come up.
Right. Dr. Kim, conditional approval has been granted for a local antibody treatment against COVID-19. What are your thoughts on this advancement, which also comes amid concerns regarding its efficacy on variants?
That is correct. I think in terms of just achievement, I think this is, outstanding because it is number third, in the world in terms of development of such antiviral. But then we are also concerned about the variant issues because even just the U.S. ones, Eli Lilly's and then Regeneron, unlike some antibodies generated by vaccination, these antibodies, some specific antibodies, just one or two antibody combination, maybe one or two may be very effective, which means that they are somewhat limited in terms of efficacy. The antibodies generated by the vaccination may just target many different parts of the spike protein. But this antibody generated by this company is only targeting one or two region. So they just variant might just evade some recognition by such kind of antibody. So actually, these companies, I think they have to actually examine the efficacy of their therapeutic antibodies against the variant viruses, whether this is still just effective or not. Otherwise, well, they also have to develop some alternatives to target the variant viruses as well.
Right. Mm-hmm. Dr. Kwak, what are your words of advice regarding social distancing guidelines after the 14th of this month, which would be after the Lunar New Year holiday?
Well, obviously, as I always emphasize, it's the 3 W's. Watch the distance, wash your hands, and wear the mask. As I constantly repeat myself, really, there are no better options of protection other than keeping the social distancing. If we have gathered as a family during the holiday, it makes sense for us to not meet other people afterwards so that in a slight chance that we might be infected from the vicinity family member, we don't spread it to any other people. So about 2 weeks or 3 weeks or 2 weeks afterwards, after the holiday, we should be extra careful not to really socially mingle with any others.
Right. All right. Dr. Kwok, as always, thank you very much for your thoughts. And Dr. Kim, thank you for being with us today. Well, until the presence of effective treatments and vaccines, social distancing, as Dr. Kwok said, and related hygiene practices remain our best option. Thank you for watching. See you tomorrow.